So let's get back to the basics right now. You're at home right now. You're not feeling very well. You think you may have been exposed to the coronavirus. What are you supposed to do? Dr. Lisa Barrett is joining us now from Halifax with the answers. Good morning to you.
Hi, how are you?
Very well. The symptoms of coronavirus include fever, cough, difficulty breathing, which look a lot like and feel a lot like a flu or a cold. So what do you do if you have these symptoms?
So you're absolutely correct. The symptoms of influenza and this coronavirus are very, very similar, along with many other respiratory viruses. And so if you have those symptoms, a fever and a cough, the best thing to do is to reach out to your local health authorities. Across the country, each province has a slightly different system, a different number for you to call to reach out and figure out what the next steps are. What is key, unless you're emergently ill, is to not run to your nearest emergency room. Right now, what we want people to do is reach out, contact their provincial health authorities at the lines that have been designated, different in each province, where they can get further advice on what to do next, especially if they think they need to be tested or if they want to know more about what to do in terms of self-isolation and social distancing.
Can anybody get a test if they want one?
That's a great question. Right now, we are really focused in Canada on making sure we have enough tests for the people who really need them. And that's why there are assessment centers all across the country, outside and near hospitals, where people can go to be assessed if their health line tells them that they should go there. But not everybody necessarily will need to be tested. And that's why the assessment centers are there, to make sure everyone is doing okay from a health perspective, but also to determine who exactly needs one of the tests for coronavirus or other respiratory viruses.
Should you be calling a hospital directly?
Calling a hospital directly, unless you have an emergency, then you should call 911. But calling hospitals directly is going to cause a real stress on our systems, and it's not going to get you the answers you need. Within each province, on each province's Ministry of Health website, public health website, or your health authority website, there are easy-to-find numbers that tell you where to call to get the best information at this time for coronavirus. So calling hospitals directly should not be your first stop. We're heading into a pandemic. We are in a pandemic. And right now, people have to take some civic responsibility as well. Each person needs to do their bit. And part of that is recognizing what the proper process is. And it's not just showing up in emergencies or calling your local hospital.
All right, Dr. Lisa Barrett, we appreciate that information this morning. Thanks so much for your time.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.